A lot of times, healthy, sensible debate is shut down by anyone who uses that word private.
There really isn't a lot of evidence on the other side showing that it would have any benefit.
A narrow vote supporting a privately funded healthcare system operating parallel to a public system at the United Conservatives' annual general meeting has re-sparked the two-tier debate in Alberta. Some say it's a discussion worth having.
Technology changes, economic circumstances change. In the case of healthcare, demographics change, societal concerns change.
Critics argue
I do have a concern that money and time will be spilled on reanalyzing, relitigating an issue for which there's already quite a bit of evidence.
we already have several privately funded services, dental, vision, and massage therapy, for example.
Do we increase privatization by inserting it into places where it currently is not? And then secondly, if there are these concerns with privatization, then should we take some of those services that are currently privately funded and pull them under the Medicare umbrella?
Others argue you can't run two properly funded systems.
Does the existence of private schools necessarily mean that public schools are of lower quality? Some might say yes, but I would counter that we can choose to fund and design public education systems in a way that ensures they are high quality, even in the presence of private education.
In September, BC's Supreme Court shot down a constitutional challenge which may have opened the door to a two-tiered healthcare system, a decision applauded by the federal government.
The BC government was actually defending its limits on private finance. In this case, what we're looking at is different, of course, because it would be the government considering not having those limits on private finance.
But even the discussion on whether we should even be discussing a two-tiered system will go on. In Calgary, Jonathan Muma, City News.